Welcome, everyone, to Deny, Delay, Depose Health Over Wealth. Today, we're diving deep into a topic that's becoming increasingly relevant, the role of AI in predicting and preventing healthcare crises. But we're also going to be tackling the crucial issues of algorithmic bias and transparency. It's a minefield, to say the least.
Yeah, it's like we're standing on the precipice of a healthcare revolution and AI is holding the match. Exciting, but also terrifying, you know? We could use AI to identify emerging health threats, personalize treatment plans, and even predict outbreaks before they happen. But then you've got these biases baked into the algorithms, the lack of transparency. It's a mess.
I think the term revolution is a bit strong. AI has potential, absolutely. But let's not pretend the current system is completely broken. We've made significant strides in healthcare, driven by market forces and innovation. AI can augment that, improve efficiency, maybe lower costs in some areas, but it's not going to fundamentally change everything overnight.
See, that's where we differ. I see the system as fundamentally flawed. It's optimized for profit, not people. Think about it. If the healthcare system prioritized people over profit, would these settlements from Meta and ABC, all this money, be going to build Trump's library? Or would it be allocated to actually improve healthcare access, preventative care, research into chronic diseases? We're talking about millions that could make a real difference.
That's exactly it. These settlements, that whole library situation, it's a symptom of a much bigger power play, Sarah. I see the Trump library as a potential symbol, almost a monument to this radical shift we're about to see in healthcare. I mean, Meta and ABC throwing money at a presidential library? That speaks volumes.
Okay, but that's a leap. Companies settle lawsuits all the time. It doesn't automatically signify some grand conspiracy to restructure healthcare. And while I agree that optimizing for only profit is detrimental, let's be realistic. Healthcare requires resources, and a market-based system, while imperfect, can drive innovation and efficiency to some extent.
But at whose expense? The news about Walmart struggling to absorb the tariff costs and potentially raising prices that directly impacts people's access to medication, healthy food choices. How can they even prioritize any aspect of their lives when the government imposes tariffs and that results in the raising of prices? It makes healthcare even harder to afford.
And Trump telling Walmart to eat the tariffs? It's an indicator, Jesus is right, that he's actively battling to restructure the economy. And it all ties back to the healthcare makeover. Remember, he's always been about disrupting the status quo, and healthcare is ripe for disruption.
I see it as economic pragmatism. Navigating the global trade landscape is complex, and tariffs are a tool, albeit a blunt one, that can be used. Walmart, as a huge corporation, has to make strategic decisions to stay competitive. The problem is capitalism, but you are right about one thing. These decisions do affect individuals, so it's like a balancing act.
A balancing act where the scales are heavily tilted towards profit. What about the article on the Pentagon limiting press access? Limiting transparency is never a good thing, especially when it comes to something as crucial as healthcare or military operations. How can we hold anyone accountable if we don't have access to information?
Exactly. The Pentagon restrictions feel incredibly connected to the healthcare makeover. The same desire for control over information, the suppression of dissenting voices, it's all part of the same playbook. That's why I see Mangian as a martyr in a way. He exposed the denial in the system. His methods were wrong, but his sentiment resonates with so many people.
I disagree. There's a need to protect sensitive information, especially in national security matters. I don't see a direct connection to healthcare. And let's be clear, I do not condone violence in any way. Romanticizing the Mangian case is dangerous. It legitimizes violence as a solution, and it isn't.
It's not about romanticizing violence. It's about understanding the desperation that leads someone to take such extreme measures. It's a symptom of a system that is failing people. Now, back to AI. We're talking about algorithms making life or death decisions. How do we ensure those algorithms are fair and unbiased?
That's the million-dollar question, isn't it? The data that these algorithms are trained on is often biased to begin with. Historical data reflects existing inequalities in healthcare. So, the AI just ends up perpetuating those inequalities. It's garbage in, garbage out.
Yes, algorithmic bias is a serious concern. We need to be proactive in identifying and mitigating those biases. That means diverse development teams, rigorous testing, and constant monitoring of outcomes. It also means being transparent about how these algorithms work. People need to understand how decisions are being made.
Transparency is key. But who's going to hold these companies accountable? The same companies that are incentivized to prioritize profit over patient well-being. We need strong regulatory oversight.
Good luck with that. The healthcare lobby is incredibly powerful. They'll fight any regulation that threatens their bottom line. That's why I think we need a more radical solution, a complete overhaul of the system.
I still believe in incremental improvements. A complete overhaul is unrealistic and could lead to unintended consequences. We need to work within the existing framework to address the most pressing issues, like access to care, affordability, and algorithmic bias.
But how many more people have to suffer? How much higher do costs have to climb before we admit that the system is fundamentally broken? Look at other developed countries with universal healthcare systems. They have better health outcomes and lower costs. Why can't we learn from them?
Because the entrenched interests are too powerful. They benefit from the status quo. They're not going to give up their power easily. And that's where AI comes back into the picture. If we can harness AI to expose the inefficiencies and inequities of the system, maybe we can create enough public pressure to force real change.
Or, AI could be used to further entrench those inequalities. Imagine an algorithm that denies coverage to people based on socioeconomic factors or pre-existing conditions. It's a slippery slope.
Exactly. That's why we need to be so vigilant about algorithmic bias and transparency. We need to demand that these algorithms are used to improve healthcare for everyone, not just the wealthy and privileged.
One potential application of AI that I find interesting is in predicting and preventing pandemics. We saw how unprepared we were for COVID-19. AI could analyze vast amounts of data to identify emerging threats and help us respond more quickly and effectively.
Yes, early detection and rapid response are critical. AI could be invaluable in that area. But again, we need to be mindful of the potential for bias. If the data used to train these AI systems is skewed towards certain populations, it could lead to disparities in access to testing and treatment.
And what about the ethical considerations of using AI to predict individual health risks? Could that lead to discrimination in employment or insurance? We need to have a serious conversation about the limits of AI in healthcare.
Absolutely. We need to establish clear ethical guidelines and regulations to prevent misuse. But we also need to be open to the potential benefits of AI. It's not about rejecting the technology outright, it's about using it responsibly and ethically.
I think a key area to focus on is improving access to care in underserved communities. Telehealth, powered by AI, could help bridge the gap. But we need to ensure that everyone has access to the necessary technology and internet connectivity.
Telehealth is a good start, but it's not a substitute for comprehensive health care. We need to address the root causes of health disparities like poverty, lack of education, and environmental pollution.
It all comes back to prioritizing people over profit. We need to create a healthcare system that is truly equitable and accessible to everyone, regardless of their socioeconomic status or background. And maybe, just maybe, AI can help us get there, but only if we're careful and vigilant.
It's a complex issue with no easy answers, but I think by focusing on transparency, mitigating bias, and addressing the ethical considerations, we can harness the power of AI to improve healthcare for all, even within a capitalist framework, without throwing the baby out with the bathwater.
I hope you're right, Sarah. I truly do. But I remain skeptical that we can achieve real change without a fundamental shift in our priorities. We need to start valuing human life over corporate profits. That's the only way we're going to build a healthcare system that truly serves everyone.
Well, whether it's a radical overhaul or incremental improvements, one thing is clear: the healthcare system is in desperate need of change. And AI, for all its potential pitfalls, could be a powerful tool for driving that change. We just need to make sure we're using it for the right reasons.
Thank you for joining us today on Deny, Delay, Depose, Health Over Wealth. It's a conversation that needs to continue, so please share your thoughts and ideas. Until next time, stay healthy and keep fighting for a better healthcare system.